So are we recording now? Okay.
Yeah.
So just the quick roadmap of where we're going today. I want to give you a heads up about Think Babies North Carolina. That was actually the funder. They gave us a little mini grant to be able to do these interviews, and they're a policy and advocacy initiative in North Carolina. So I want to make sure you know about that. I'm going to talk briefly about just where this project came from and a little bit about who the participants, the interviewees were. And then also just a little bit about the workforce development program for anybody who doesn't know what that is. I think most of you do. And then the bulk of the time, we're going to be looking at some of the key themes that came out of the interviews that we did. And then discussion is going to be open discussion in about 20 minutes, and hopefully, both reflection and starting to think about what we do with this and how we might support families differently or act from what we're learning here. So this is the Think Babies policy agenda. Think Babies focuses on infants and toddlers, 0 to 3. And they're really looking at a couple key things: expanding health insurance, expanding home visiting and parenting education, and then several different strategies for expanding access to early childhood education for that 0 to 3. We've made some progress, I think, in the preschool 4 and 5-year-olds, and less progress in some of those key steps with 0 to 3. So Think Babies is a statewide initiative to bring more attention, awareness, and some advocacy to those efforts. And they funded, with a little mini grant, our ability to do this project. So when we wrote that mini grant back in the summer, in the middle of COVID, right, we knew that it would be hard to engage new parents we didn't already have a relationship with. So we wrote it to engage workforce development program participants, because we had a relationship with those participants, and they're also a pretty diverse group of folks, most of whom had young children. And I'll go into that more in a second. But and our main questions, which are still relevant at that time when we wrote the grant, are really focused on how are families of young children adapting in this time of COVID, and thinking about childcare and other needs differently, potentially. And then also, because we were going to be interviewing our workforce development participants, wanted to make sure we got some information about the impact of that program and feedback about that program. So there were 13 interviews total, mostly done in September, a couple earlier, a couple later. Took about 45 minutes, and then they were all recorded and transcribed. And I've been digging through all those transcriptions and trying to pull out what are the main things being said here. So that's what you'll be seeing today. The mini grant that we got was what allowed us to give our participants a $50 gift card to say thank you for their time and their expertise and sharing their stories. So the participants, there were 13 women, all with children under 5. Almost all had children in that 0 to 3 category. There were 1 or 2 that just missed that. 9 of the 13 had multiple children. So a lot of what you'll hear includes information about school-age kids and comments around the school-age children as well. And there was no way to separate those conversations, right? There is no separation of pre-K and K-12 in a family who has both. And then there were at least 5 single parents. That wasn't a question I asked specifically, but most people kind of identified either I'm a single parent or my husband, my partner. And then 8 people pre-pandemic had kids in center-based programs, 3 had kids in home-based programs, and a couple had kids who were not in any kind of early education program. And then they were, for those 13 folks, were pretty diverse, racially, ethnic. We had 3 native Spanish speakers as part of our interviewees, and a pretty wide range of educational background as well. I have this big red note on qualitative data here because I want to be really clear that we are not suggesting that these 13 interviews are supposed to be representative of all parents in Buncombe County, or of all mothers, or of all parents of, 0 to 3, or anything like that. Qualitative data, story data, interview data is not about being representative of the whole population. It's really about going deeper into we have some surveys and some numbers about how many parents have kids in childcare and that kind of thing. But this is to start saying, why do those numbers look the way they do? What are some of the ways parents are thinking about this in their heads, framing the choices that they have? It's not representative, but it does give us a much deeper sense of what's going on. So real quick, the Workforce Development Program has been around for a couple of years. It's focused on training recruiting and training new people to become early childhood educators. Back in 2018, we had a crisis. We need more educators, qualified educators, and we still do, even more today, I think. The program to date has had 63 participants, 26 of whom went through the program primarily in Spanish. So that's been a really exciting development, that we've been able to offer the program in Spanish. I say we, it's really Tasha and Erica. And the program, the main components, they're 24 hours of paid training, time where participants get all the kind of basic trainings that they need going into a classroom, CPR and SIDS and some, the sanitation kinds of things, basic child development concepts. They also have an opportunity, pre-COVID more than now, to substitute in some of our partner centers to get more work experience and just get a sense of what it's like to work in early education in different kinds of centers. They also have support, financial and other supports, to complete the foundations of early childhood education class through the community college system, which will get them a certificate, to the early childhood certificate, which is kind of the entry level teacher requirement in North Carolina. And there are lots of wraparound services, wraparound kinds of supports to help participants be successful in this. So pre-COVID, the trainings were held in the evenings. There was always childcare offered, and dinner was served to the participants and the children. Transportation support was given when that was needed, so that parents really could participate. Even single parents who were juggling all the things were able to do this. Yeah, so now I'm going to be jumping into the meat of what the parents really talked about in their stories. And so most of the slides that you'll see from now on have this colored box on the left that's more of a general theme that came out of multiple conversations. And then on the right, there are some example quotations, the direct words from participants that kind of illustrate that. I'm not going to read all of the quotations, but this will eventually be available in a report form, and the recording will be available. And I can make the PowerPoint available as well. So the first thing that came out is something I really want to celebrate and say, look, this is good news for our field. There were a lot of folks in the conversations that listed all the reasons why early childhood education was a really good career choice for them. And they included kind of flexibility, being able to work, some around kids' schedules and things like that, more reliable pay than some of their previous work experience, the ability to really learn more about child development and parenting and that kind of thing, and as well as kind of addressing challenges they've had, either in just accessing childcare themselves, or maybe not having a great childcare experience and wanting to offer something better. And then 9 of 13 of the participants expressed a real long-term interest in working with young children. So this is something they've wanted to do. Let's see, so that first quotation up there, she says, of course, I'm a mom of 3, so anytime I can learn more about teaching or being a parent or anything about working with children, I'm always up for that. And so as a field, I think we often spend our time bemoaning, the pay isn't good enough, and the work conditions, the benefits, they're not enough to entice quality teachers. But what these folks were saying is, there are a lot of reasons why this really does work for us. Not that we need to stop advocating for better pay and better benefits and more supports there, but that's something to celebrate. Another thing that rose, I talked earlier about the childcare and the dinners and transportation and some of those wraparound supports. There were 9 out of 13 of the participants said that they absolutely could not have done the program without those things. And that's an important kind of theme in itself. But what was more interesting to me, and what's here on this slide, is around not only they were able to do the program, but there was a real sense of pride and accomplishment and a sense of personal investment that those things allowed. And most of these folks that I interviewed, they were really focused, of course, on their families. They all had young children. They were not in a place where I think many of them had anticipated being able to focus much on their own education, their own kind of career development in this point in their lives. And so that first quotation there, she says, I feel like the opportunities that you guys, being this program, give us allow people like me who have a lot of barriers and obstacles, it allows us to feel like it's attainable. And I heard that from multiple folks. So moving away from specifically workforce development into more general topics, there are a lot of people, I asked specifically if people considered early childhood education a career, long-term career for them, and people, there was an answer there, but the conversation went a lot deeper into a lot of the financial and situational impacts of COVID-19. And it was a pretty amazing, slap in the face, honestly, about working women's roles and limitations in our society. Just make that big, broad comment. So like I said before, and it says up here in green, 10 out of the 12 people were definitive in saying early childhood education is something they're considered, they want to pursue as a long-term career. And they really, that sense of accomplishment of going through the program was, they saw themselves as professionals, as beginning to really embark on this as a career, as opposed to just, something to help pay the bills. But every single person I talked to was absolutely clear that that's on hold until schools are back in, my kids are a little older, or whatever those kind of situational barriers were. So that first quotation kind of illustrates that. She says, early childhood education was something I was ready to jump into head first. And there was a lot of language around that, like that. But COVID messed everything up. I'm a single mom. I have no childcare for my own 4 children. So I've just been at home ever since this happened, when the kids got taken out of school. It's really put my career on hold. And everybody had that story, basically, just about. A lot of people focus more on the K-12 closures as particular barriers to going to work than the 0 to 5. And I'm thinking that might also have been because of the time period that these conversations happened, which is mostly in September, right? When schools were kind of going back and forth about, are we going in person, or, are we plan B, are we plan C, who's going, is it is it a week on and a week off, or a day on and a day off? So that was very high in top of people's minds. But that second quotation there summed up what a lot of folks said, which is, she says, I think it just really heavily depends on what happens with schools. There's so many things you can do when there's the school resource available to you. And when that resource is no longer available, then you become much more limited. I think part of that also is K-12 we have always been able to rely on K-12 as being there, right? Maybe people are expecting to have to be a little bit more flexible with 0 to 5, but K-12 not being reliable really made it impossible for so many of these folks to consider their own careers. Another thing that's more about the financial impacts that's really important to highlight as we're talking about supporting families moving forward in all kinds of different ways. There are some significant new expenses and significant barriers related to COVID-19 that people, even super resourceful folks, are having to deal with now. So both of these quotations were single parents. And I want to read both of them because I think they're both really point to important things to think about. So the first one was talking about her kids going through a lot more resources, shampoo, garbage bags, you name it. They were just using it more, doing more, having more laundry, eating more food, more hot water. My electricity bill like quadrupled, just stuff you don't consider having kids at home all the time. And then the second quotation, I have to move my little screen here so I can see it. Well, it's definitely made it more stressful having kids at home with me while I'm trying to go out and find these resources that we need. And she was specifically talking about things like accessing food pantries and some of the kind of public resources. She says places have made it harder as far as coming in. Everything has to be done over the phone or by email. And I struggle, to pay my bill here at the house to even have the internet because it's harder for me to get out and find an income. So again, super resourceful folks who know how to find what they need for their children struggling in a new way in this time. Some participants were, again, coming back to that, the impact on women, were real explicit about that. The second quotation here really sums that up. If there was more funding, then I think women wouldn't have to make the choice of kid or job, because every time they're going to choose the kid. And that's what stinks about it, and why no one is bothering to help, because they know that women will pick up the pieces. That's just what we do. And 11 of the 13 women that I interviewed either stopped working or stopped actively looking for work because of childcare, not because of COVID, but because of childcare or the demands of virtual learning. And the impacts were compounded that much more with the single parents. Want to mention a couple of non-financial COVID-19 impacts that folks mentioned. And one of these is a real celebration. And again, I want to make sure that we're bringing out the positive and the strength in all of this, because it's so easy to get sucked into 2020. But several participants really made a point of celebrating their own resilience in this time, and their kids' resilience as well. So one person, the second quotation there, she says, I've stepped up. I've made some trips to the Dollar Tree. We got some crafts, some books, some puzzles, stuff that we could do to learn about different things. And I just pretty much, instead of her teacher doing it, I try to teach my child. So I don't think it's impacted me in a negative way. I've just basically dealt with it. And several people talked about their own resilience, even when it was hard, as well as their children. And the flip side of that is that it has been incredibly, incredibly difficult. And, you know, people were real open and clear about that as well. The first quotation here, and this is a single parent. I think both of these were single parents. She says, after the first 4 months, I noticed I was kind of losing my grip at home. Just, you know, you're just not used to having all your kids at home all the time. And then I just never had any downtime. And yeah, I started to kind of just be like, oh my gosh, this is getting to be too much, even though everybody's good kids. And there were so many people who said that, just when is my downtime? Lots of people talked about the help that they used to have, that because of COVID, the grandparents couldn't come over, or the neighbor couldn't watch the kids. And so all of the little windows to have space for themselves were really gone. And so when I asked about impacts on the children, most people were focused on social emotional impacts of COVID and the closures on their kids. The last quotation there, she says, my son's now used to just being with me at home all the time. When we go out, he cries more because he's not used to being around other people. He's not used to being placed in his car seat. Lots of people with older children really talked about the kids missing their friends. But a lot of folks, you know, expressed surprise at how well their kids were kind of taking the changes and things as well. I mean, kids were definitely experiencing a higher stress level too, but I think parents were really celebrating how well, in many ways, kids were doing there. We're close to the end because I want to get to the discussion, and I feel like I'm talking way too much. I'm sorry. So a little bit about childcare preferences. This is one of the things I asked really explicitly. One of the things we went into this project kind of assuming is that parents were going to be looking for smaller childcare settings, that because of COVID, to reduce exposure, maybe a family childcare home or a smaller center or that kind of thing. So that's one of the things that I asked about explicitly. And most people really didn't respond that way. So a lot more people talked about the trust and the communication that they had with their known provider. If their kids were with a center before COVID, even if their kids were out now, even if the kids weren't going to the center because a parent, you know, wasn't working, or the older kids were at home, and so the younger kids were staying home too, people mostly expressed real comfort with sending their children back to the center that the kids were in, because lots of times because the center had done a good job of communicating with parents. That first quotation, we were pretty confident sending him back because they sent us updates along the way. During the time they were closed, they'd send us updates, like which classrooms they were cleaning, what they were going to be updating, how often they were going to be cleaning. We've always loved them, but they really eased our fears. And so, you know, there was more hesitation with people with young kids who had never gone to a center. But for the large majority of folks in the conversation, the trust really outweighed the sense of safety around size and that kind of thing related to COVID. There were people who definitely preferred smaller programs, but they just mentioned kind of the social or the educational benefits. They're, you know, when they said, oh yes, I'd love to send my child to a smaller program, it was always conversations like this. The relationships between the students are stronger and better. My child gets more attention that way. So it really wasn't primarily, at least, about safety and COVID. So this is my last slide. And these are just some other little takeaways. I didn't, put the whole quotations and things together, but just some other things to kind of throw out and start to ponder as we're thinking about families and childcare and what our next steps are as a community. One thing, there were a couple of centers that it seems like are really actively referring their own parents to the workforce development program, and really intentionally kind of growing their own teachers in that way. And from the parents' point of view, I heard a lot of loyalty and appreciation there, and the strength of trust and a long-term relationship with the center, I think is going to serve them well in the future with teachers. So something other programs might think about. There's more education needed around, of course, we know this, but early education versus daycare. A lot of the workforce development participants noted how much they learned about how much even the youngest kids were learning in these programs, that they didn't kind of think that way before the program. Home visiting was mentioned several times as people's introduction or kind of gateway into early childhood, into center-based care and that kind of thing, that they hadn't really considered it until their nurse-family partnership visitor started talking to them about the benefits of early childhood education. So it's just something that we can leverage. And then there were a lot of people who really saw the benefits of small settings and family childcare homes, but people didn't quite understand or quite trust, I think, home-based care. And so there's some communication to be done there to really make sure people know that family childcare homes are held to exactly the same standards, programmatic wise. Infants and toddlers, there's my kid. Infants and toddlers, especially, I saw more of a delay in starting early childhood education for the little ones. People whose kids had been in programs felt pretty comfortable putting them back there, older kids. But the younger ones, a lot of people said, well, they can't wear masks, they lick things. I just don't feel comfortable. So they're really getting a delay a lot of times in starting early education, just something to be pondering. Neighborhood safety came up a couple of times as a heightened concern around COVID, right? If they're for kids who aren't getting a lot of socialization at school, and parents don't necessarily feel comfortable letting them play outside a lot in a neighborhood that may not be safe, there was kind of an added concern around those kids' social emotional needs. And then one thing that I kind of mentioned earlier, in parents' world, 0 to 5 and K-12 are a continuum, and I feel like we service provider people in those fields need to be treating it more as one as well to serve parents better. So that's what I got. And again, this was a lot of information. There's so much more there. I want you to read all of these parents' words and stories and really get a sense of what life has been like. For those of you who have 4 children at home, God bless you. And so I just want to throw it out here and first say, are there any initial reactions, initial thoughts, or kind of clarifying questions that you were wondering as I was talking? So I'm going to be quiet now. Please speak up.
Deanna, should we take it back to so we can see each other? Yeah. and not sharing the screen? Or
that is an
that might be
excellent
helpful.
There. Are we back? Can you see everybody now? Excellent. Does anybody have any kind of questions or about any of the information? Is there just any kind of clarifying things that are hanging out there?
Comment that I really could relate hearing what the other moms were saying, because in your own day-to-day, and you're like, oh, I'm probably the only one that's this overwhelmed or feeling this way. And then to hear all the comments, it was like, oh my goodness, everyone feels exactly the same way. It was not refreshing, but maybe misery loves company. But it was, I really enjoyed hearing the honesty that people are just like, yeah, I have all the kids home all the time, and it's a lot. And there's just so many moving parts, the money and the me time and the resources. It's just I really enjoyed hearing the comments. It was just like so relatable, and just yeah, I mean, maybe it doesn't lead to any solution that everybody's like feeling the same way, but at least you're not alone, and that everybody's like working with the same set of problems.
Yeah.
So that's all.
Yeah, I had the same thought actually. Like Tasha and I were meeting an hour ago, and about the same time as she got hit with a Nerf dart, my kids started fighting in the hallway, and we're like, okay, but what was that number? Like trying to, like get the budget number in the right place. And, like same, just like it was kind of, I know the program really well, but hearing the honesty and the kind of the piece about like what it's really like, it was absolutely, Bethany, like I was like, oh my God, it's not just me. Yeah, that's great.
Yeah.
I would say that an observation, I would take away from all of this is just that the pandemic has certainly exacerbated things, but it hasn't created too many new problems. There's a lot of these problems have been problems for a long time. And they're just getting worse with the pandemic. And of course, as you pointed out, Deanna, it always disproportionately affects women every single time, which is just too bad, because then the marketplace misses out on all that talent, that good golden talent, that it needs. And it's not a bad thing necessarily. I mean, we need to take care of our children, and mothers are probably the best people to take care of their own children, and so there's like this golden thread that weaves through all of it, right? And you can take pros and cons out of it, but yeah, I mean, it's just it's unfortunate that it's going to fall on the women's shoulders every single time.
And I wanted to also add to that with our families that we work with and our participants that we work with coming in that are same-sex couples with two women, and I speak for myself, I run the household, so I'm working from home with our two children, and my wife is in the office. So there are so many different, I definitely agree with you, Deanna and Tracy, about the women being the ones. But what happens when there's two women, or when there's two fathers? And we've had participants that are in the same situation, and it's, on top of COVID, on top of, other things that the world throws at us. It's very, very hard. It's very hard. And I'm the director of this program, and it is insanely hard. Ask Erica when we can talk. Ask Deanna when we could talk about, this project.
We read each other's minds.
We read each other's minds, and we text and email late at night, So but I'm so happy that Deanna was able to, tap into the minds of our participants, because it's really important to hear all these things, compiled into one. And, you know, with the communication that we keep open with our participants, you know, they're able to talk to us whatever they need to talk to us. And it doesn't matter, you know, it doesn't matter what time, but to see all this information and your thoughts in this presentation is, you know, honey, I'm right there with you, you know. I'm right there with you.
Yeah,
Deanna, I
for
wondered.
that, Tasha,
Oh, go ahead.
for bringing up, you know, all of the situations. Yeah, it's yeah. Sorry, Jane.
Oh, no, no problem. I wondered, Deanna, if you saw any significant difference. You said you had a fairly good number of women of color participating. Did you see any difference in the responses?
So not that I have specifically found yet. And again, I haven't, like I said, this is kind of preliminary first dig into things, but nothing that stood out. Most of my questions were really, really broad and open-ended, because with the story data, you get more, like it's much more interesting what comes out naturally from participants than what you kind of prompt and ask the, you know, details about. So so I didn't ask specifically about experiences related to race, and nobody volunteered that, but of course, you know, I'm a white stranger, so they may, you know, not. But I do still need to go back and really read kind of between the lines, fine tooth for some of that potentially, but nothing that stood out, no.
So I was surprised by there being no real strong interest in families enrolling kids in family childcare homes. Just, I guess, I'd kind of make that assumption that they might feel that it's a more comfortable option with close relationship with one adult and smaller group.
Yeah.
Of course, I'm just feel very badly and disappointed for workforce development folks who were ready to really get into the work, and then, you know, had to make tough decisions for their own family and felt like they couldn't, it wasn't the time to start their children in childcare, which is now preventing them from working.
Yeah.
So that is a real challenge that I saw that came through from as a result of the pandemic.
Yeah.
Amy, I mean, Deanna touched on this, but I think as our numbers of family childcare homes have declined, people don't really understand what they are. Yeah. You know, we used to have, you know, what, easily 7-8 times the number we do right now. And with that, you know, people are kind of falling out of common knowledge, right, about what they are and how great they can be. Yeah.
Yeah, and crossing cultures as well too. At least as I was living, you know, in Central America, it's not a very common thing to have childcare in your home. You would tend to go to more centers where there would be a larger group of children with more like 2 or 3 teachers in a classroom. So it's kind of like, yeah, that experience of going to school when you're a young child, as opposed to, yeah, going to a home to get educated.
I was just going to say,
oh, go ahead.
I was just going to say, anecdotally, as someone who answers our main line and answers questions about childcare, there does seem to be hesitance on the part of the families and the moms I talk to about family childcare homes whenever it gets mentioned.
Yeah, there was just a sense from the participants that there was like, oh, but it's in somebody's home. I don't know. Is that monitored? Like it you know, like it just didn't, it was a under the skin kind of a gut sense. But I do think what it made me hopeful that the state initiative around Wonder School with family childcare homes might really help with that marketing and changing that sense of what family childcare homes are. Because like I said, people were really interested in smaller programs for the, you know, educational kind of benefits. But the home thing just wasn't familiar, and I think that's about community education. Another interesting thing is that I didn't mention, several parents, when I was talking about smaller settings and larger settings, several parents were thinking about their, you know, 100 child early ed center and comparing it to K-12 and thinking that's really small, as opposed, you know, in my mind, 100 kids is a big center and, you know, family childcare is small. They were thinking 800 kids in an elementary school, big, 100 kid center, small. So there's a lot of context difference, a lot of which really depended, like for people who had school age kids, that was more what they were comparing to than people who didn't. So. Curious if it has sparked, if any of this has sparked thoughts about here's something we should be, we as a community should be doing differently, or you know, potential points of leverage that we could move forward with as a community.
I don't know if this is an extremely radical idea or if this is something that everybody is talking about and I'm just late to the party. But I would offer up that, you know, in my opinion, if we're in an age of dual income households, more and more single parents, you know, this age and time where, you know, there was a time when everyone was at home and all the work was done at home, and, you know, we were all homesteaders, you know, kind of a thing. But then Industrial Revolution happened, and that's just not our world anymore, right? And at that point, we decided that, okay, public education should be, you know, a universal good. That's something that tax dollars go towards, and everybody should have access to free public education. I would offer up that the same should be true of early childhood education. It is equally, if not more so, important. And it is impossible to live in the society that we've created for ourselves post-industrial revolution without it being a public good. I mean, impossible is hyperbolic, but it's very difficult. And because, you know, any family's top dollar that they put towards childcare, and I say that loosely, I know childcare and ECE are not the same thing. But, you know, they're the top dollar that they put, you know, it's putting them up against a mortgage payment almost, or above a mortgage payment. It's still going to only ever equal something around the poverty line for the provider. And so without some sort of subsidy there, there's the economics of it is never going to work out. And so, yeah, I would just offer up that this is a public good need just as much as K through 12 education is.
Tracy, so well stated. Can we bring you to the legislature? Yeah, right there with you. Really see it as a critical service and part of the full education continuum.
I'm sorry, my dog is not cooperating, but I wondered if there is a way in the pandemic for childcare centers to serve as matchmakers for people who need a pod, people who need other parents to, you know, to share the homeschooling or share the virtual kindergarten or whatever, or virtual childcare. But, you know, that a lot of the parents that are now home were connected to a center at one point. So maybe there might be a way to take on that role? I don't know. It's just a thought I had listening to you, because I think one of the hardest things is not just all the new stuff, but also the isolation, with especially if you have a lot of children.
Yeah, and people were pretty clear about the impact of isolation too, and very clear about where they got their social support, and or if they got social support. And Jane, I just want to add, Jenny Hernandez added to the chat something that is kind of related to what you just said. And she said she prefers chat because English isn't her first language, but it's beautiful. She says, thank you very much for the presentation. I can feel the feeling and worries of those parents. I only want to say that I'm thankful to participate some way with you. I want to share with you about something that we are doing in Emma community. Maybe you have heard about it, Time Bank, meaning sharing time with the kids in your family, neighborhoods, and communities. So I think that if I'm understanding, and I think Ginny had to leave, so she can't give more information, but maybe we can get more information about that. But I think Time Bank is generally kind of almost like kind of a co-op model where I can take care of your kids one day if you can take care of my kids the other day, and we're giving each other a break, and we're creating some space for each other, working together. So yeah, Jane, like, and I've heard other people talk about how the kind of organic way the learning pods have come about is giving is a good example of what we should be thinking more about, right? And that it's worked well for some families for lots of different reasons. And again, back to several people's comments, so smaller groups are always going to feel more nurturing to folks. And so how are there other ways we can support that and make those pods more accessible to parents who can't, pay an educator to come and lead them, or that kind of thing?
I just wanted to say that with the numbers continuing to rise, we are at the most scariest part of the pandemic, way more than what we were before, when we first started. And a lot of families are, limiting who are, I don't know if they're doing a better job or continuing to limit the amount of people. And I know that, that was the biggest concern too, when we reached out to participants who had multiple children that were grade school aged, about creating a pod. At first it was the interest, but as numbers started to skyrocket, it became more clear to them that I can't take any chances. I'm already, they're already, hanging around, with grandma who is older, or we're living with grandma, or, it's just, it's scary, and I understand, mask protection, washing your hands and all of those things, but that's something, that people are thinking about as well. Because it would be great to have, sometimes, timeshare with another parent, but you don't know what that other person is doing when they're not with you. And so that's even scarier. And even, in centers, you don't know what your staff is doing. You're hoping that they're being, precautious, but you just don't know. And it seems that, the cases that I know of, both with friends and family, kids aren't showing any symptoms, but they're the ones carrying it. But you don't know, you have no idea. So that's the scary part. You just don't know, and you want the support, but you don't know how to go about it, because, we're in a pandemic.
Thank you for mentioning what Genie had put in the chat. I agree that I think Poder Emma is doing so many beautiful things. It's such a rich resource in the community. And Werner, as we're moving to our new Werner Central and right next door to Children First Communities and Schools, and with Emma Elementary School, we're trying to build relationships with multiple different community partners. And there are so many beautiful community organizations within the Emma community. So I hope that we, with our work with Asheville Buncombe Preschool Planning Collaborative and the early education community, we can definitely follow up with her, because that's a great, rich idea, and look forward to continuing that conversation. And the other thing that was occurring to me as I was listening to the comments and the thoughts that parents have shared in the interviews is, I mean, obviously having more family childcare homes and programs is so important in terms of diverse resources that we in the field of early education can offer in our community. And I feel like the more that families, caregivers can have a choice in where they leave their children, how they get care outside of the home for their children, if that's something that they need, I feel like it only strengthens the field to have more options for parents to consider. So I personally, even though I work with a center-based operation, I see the loss of our family childcare programs as a very serious loss to our field and to our community. I personally, as a parent, have really had some wonderful experiences in family childcare homes for my own children when they were younger. So I don't have any answers right now, but there's a lot of really smart people in this group and a lot of really smart people who aren't on this particular call that I think we collectively would benefit from looking at that together. What can we do to, I know it's really, we all know how difficult early education is to make into a sustainable business model. And that's one of the many reasons that some of our family programs have closed, but I'm sure there are solutions. And really, I am also shocked that in the pandemic, that's not an opportunity that families are seeking more for their children, just to reduce exposures. So I'll stop there. I think we're all saying the same thing, but I just would offer that as two opportunities for future conversations.
Yeah. Well, it is 5 o'clock on the dot, and I know you all have families and lives to get to, but I really appreciate the time that you've spent with this conversation. And I also strongly invite you, if things come up for you later, if questions come up, if tomorrow morning you're taking a shower, that's when all my thoughts happen. Scribble it down, send me an email as you're thinking about number one, what other ways that this information might be used as a communication tool or an advocacy tool, some of the things that came out of these conversations, and number two, ways that our community, whether it's Asheville Buncombe Preschool Planning Collaborative, Buncombe Partnership for Children, our local funding communities can be thinking about supporting families differently. So please email me or call me or email me the napkin that you write your idea on, and let's keep this conversation going. It's not the thing with easy answers, but we're having the conversation, and I really am grateful that you're present and part of that. So yeah, let's see, people are kind of saying thank you and goodbye now. I will make sure that I capture all of the chat as well. Really appreciate it. Everyone have a great afternoon, and
thanks so much, Deanna, and thanks to Erica and Tasha for your great work. Appreciate it.
Yes, for sure.
Have a good evening, folks.
Thanks, bye.
Bye, everyone. Bye.
You're gonna send me all this stuff. You did great. It was very inspirational.
Oh my gosh, I was pulling it together at 1 a.m. last night. Like, crap, I had to really work on